Welcome to Sciencera. In this video, I'm going to discuss some of the exam questions from past exam papers or all the questions which requires you to apply your knowledge to the different scenarios. So let's begin. The first question here is patient A has abnormal increased level of cortisols. Using your accumulative knowledge of endocrinology, what are the different type of stress that increases the cortisol release? So they ask you this for the 5 marks. We're going to start with discussing as your body perceives stress, your adrenal gland make and release the hormone cortisol into your bloodstream, often called the stress hormone. Cortisol causes an increase in your heart rate and blood pressure. It is your natural fight or flight response that has kept humans alive for thousands of years. Normal level of cortisols are also released when you wake up in the morning or exercise. These levels can help regulate your blood pressure, blood sugar level, and even strengthen your heart muscles. In small doses, the hormone can heighten memory, increase your immune systems, lower sensitivity to the pain. Danger of a fast-paced culture, however, is that many of us are constantly in high stress mode. If your body experiences chronic stress, you may begin to feel unpleasant and even dangerous effects such as fatigue, irritability, headache, increased blood pressure, weight gain, anxiety or depression, low libido, difficulty recovering from the exercise, erectile dysfunction, and poor sleep. When the adrenal gland releases cortisol into your bloodstream, the hormone trigger are the floods of glucose that supplies an immediate energy source to your large muscles. It also inhibits insulin production, so the glucose won't be stored but will be available for the immediate use. Cortisol narrows arteries, while another hormone, epinephrine, increases your heart rate. Working together, they force your blood to pump harder and faster as you confront and resolve the immediate threat. Hormone level return to the normal as you severe to miss an oncoming car, find out that your child has only a few scrapes to meet the deadline of your presentation. Increased blood sugar level. Insulin typically helps the cell convert glucose to energy as your pancreas struggles to keep up with high demand of insulin. Glucose level in your blood remain high and your cells don't get the sugar they need to perform at their best. Weight gain. As your cells are crying out for energy, your body may send signal to the brain that you are hungry or need to eat. Studies have demonstrated a direct association between cortisol level and calories intake in population of the woman. Suppressed immune system. Cortisol positive action to reduce inflammation in the body can turn against you if your level are too high for too long. Elevated level may suppress your immune system. You could be more susceptible to cold, contagious illnesses. Your risk of cancer and autoimmune diseases increases, and you may develop food allergies. Digestive problem. When your body reacts to a threat, it shuts down other less critical functions such as digestion. If the high stress level is constant, your digestive tract can digest or absorb food well. It's no coincidence that ulcers occur during this stressful time, and people with colitis or irritable bowel syndrome report better symptom control when they get their stress under control. Another factor is heart disease. Constricted arteries or high blood pressure can lead to blood vessels damage and plaque build up in your arteries. They could be setting the stage of a heart attack or stroke. Um, there's a saliva test that can measure the amount of control in your system, or your doctor may have other ideas about what's the cause of your symptoms. Be aware of your own stress level and take steps to manage your stress. Simple practices such as getting enough sleep, exercise, meditating, deep sleeping technique, and scheduling leisure activities are the good start. So this answers the question of how endocrinology knowledge can help you deal with different type of stress in the increased cortisol release. Okay. Next question is, patient B have been involved in a car accident which left him with zero neural control. As a physiologist, explain why it is not advisable for patient to have food eaten by mouth. Also state the physiological importance of neuronal during the food consumption. Patient B has been involved in an accident which left him with zero neural control. As a physiologist, I want to explain why it is not advisable for a patient to have a food eaten by mouth. Regardless of a type of food eaten, the process of consuming food requires a lot of neural input. There are a lot of neurons involved in the process of swallowing, and these neurons are located in and around the brainstem. If these neurons are not functioning, the patient will not be able to swallow the food and will not be able to digest it. This would detrimental for the patient because he is not getting any nutrition from the food. Patient B has been involved in an accident which left him with zero neural control. This means that it is not advisable for patient to have food eaten by mouth. There are many reasons for this, but the most important is that it is impossible for patient to swallow the food. This means that the food would fill up their airway and they could suffocate on it. The patient also has no control over the muscles in their mouth. The patient would be able to swallow food as this requires neural control. The food could go down the wrong way and cause aspiration pneumonia. Next question is, the mother of a 1-year-old baby is visiting a doctor, complaining about their baby's overeating behavior which has resulted in the development of obesity. As a doctor, you suspect that there might be a neurological defect in the baby's brain. Explain to the mother all possible scenarios that might be associated with overeating. Since the child is 1 year old and is overeating, he or she may have been this eating disorder, which can be in form of uh, binge eating disorder. In binge eating disorder, people eat a lot of amount of food in a short span of time. They have calories intake in excess as compared to the requirement of the body, which can lead to obesity in these people. As this child is also having the obesity due to the overeating, which can be due to some neurological defects in the brain, if this habit of child persists, this can lead to serious complication further in his or her life. So as a doctor, it is our duty to explain the mother the possible scenario which has been associated with overeating. I will explain the mother. Due to overeating, this child can develop hypertension, diabetes, ischemia, heart disease, high cholesterol, asthma, or some type of cancer further in his or her life, which may be life-threatening for the child. We will explain the mother about treating this overeating in the child. So, will advise mother to practice healthy lifestyle for this child and to control this child's diet, which will lead to reduction in weight of this child and will control the progression of the complication. First thing which can be done in the child is behavioral therapy, which will include change in the behavior of child towards eating. If this disorder is controlled, we can prevent the child from many diseases which can develop later in his or her life. Next question is, patient B has recently been diagnosed with autoimmune disease and a few months later he also developed hypertension which has subsequently led to his hospitalization. His blood test results indicate increased cortisol levels. Explain to patient B what condition he is suffering from, what causes it, and what is the recommended treatment. Cortisol is a hormone that contributes to the bodily function, including the fight or flight response to stress. Since Mr. B is suffering from the autoimmune disease, he must have been taken glucocorticoid medicines to control it. Continuous use of these medicines can cause abnormal cortisol level. Since he is having hypertension, he may have adrenal crisis too. To confirm it, we need to follow up with other cortisol tests in saliva and urine. The recommended treatment would be to reduce the dose of glucocorticoid medicines, which is used to control autoimmune disease. Also check for any tumor growth in any part of the body. Next question. After performing an MRI scan in one of your patients, you notice a total damage of somatotroph. Using your physiological knowledge, explain to the patient how this will have a negative impact on their proteins, fats, and carbohydrate metabolism. Before we continue with answers, I just want to remind you all that all the notes are available on Stovia to download from my page called Sciencera Tutors. Okay, let's come back to the answer. About 50% of total endocrine cells of anterior pituitary are the somatotrophs. Somatotroph secretes growth hormones. Growth hormones are also known as somatotrophinins. Since GH or growth hormone support postnatal somatic growth, growth hormone has many metabolic effects. Their effects on proteins include growth hormone has anabolic effect on protein metabolism. Growth hormone increases amino acid uptake into the cell. They increases protein synthesis in ribosomes, stimulate the transcription of DNA, and it decreases the catabolism of proteins and amino acid. Their effects on fat metabolism. They increase the level of circulating free fatty acid, mobilizes fat from adipose tissue, increases the conversion of fatty acid into acetyl coenzyme A. They has protein sparing effects, has ketogenic effects. For example, excessive growth hormone mobilizes more FFA so that the large quantities of acetoacetic acid are formed and released to the blood. Then effect on carbohydrate and metabolism. Growth hormone is diabetogenic. Growth hormone increases the production of glucose by liver. They increase insulin production and decreases insulin sensitivity. They decreases glucose uptake on adipose tissue and skeletal muscles. Here the total somatotrophs are damaged, so growth hormone production get interrupted. Deficiency of growth hormone result in dwarfism. Pituitary dwarf is associated with short stature and delayed bone and sexual maturation. So these are the effects of growth hormone on your carbohydrates, fats, and proteins. Okay. A 40-year-old man consults with a doctor complaining about excruciating pain, stomach pain. Following his assessment, the doctor notifies him that he has erosion inside the stomach. Name and explain what causes the condition. Erosion gastritis is a type of acute gastritis. Acute gastritis is an actual mucosal inflammatory process of transient nature characterized by hemorrhage into the mucosa and in severe circumstances by slowing superficial mucosal epithelium called erosion. The common causes include NSAIDs like aspirin, radiation exposure, alcohol, H. pylori infection, exotoxins of Staphylococcus aureus, recent bacterial or viral infection. Okay. Next part is discuss the feedback mechanism that help to ensure that the above mentioned does not occur. The parietal cell of a stomach secretes acids like hydrochloric acid. Gastric mucosal barrier protects the mucosa from noxious agent entering into the stomach. Excessive acid protection damages the gastric mucosal barrier, which predisposes to the gastric erosion. G cell of the pyloric antrum of the stomach secretes gastrin. Gastrin is a peptide hormone that stimulates the secretion of gastric acid by parietal cell of the stomach. It helps in gastric motility. Negative pH of a stomach causes release of secretin from the S cells of the small intestine. Secretin increases release of biliary bicarbonate secretion along with bicarbonate-rich pancreatic fluid. Secretin enters the intestinal lumen and stimulates bicarbonate secretion. This neutralizes the gastric acid and protects the gastric mucosa. Secretin inhibits the release of gastrin from G cells of pyloric antrum. This inhibits gastric acid secretion. This feedback mechanism prevents erosion in the stomach. Okay. Patient C presented to hospital with 1 week history of constipation associated with abdominal pain and progressive abdominal distension. What possible condition can patient expect to suffer from? What causes the development of this condition? The patient is expectedly suffering from the bowel obstruction. It is a gastrointestinal condition in which the food that is digested is not allowed to move out normally from the bowel. It is caused due to fibrous tissue that compresses the gut. It can be occur due to the medication of any surgery even after many years. Okay. Next question is, as a physician, you have diagnosed patient D with atherosclerosis. Which factor would likely increase one's risk of developing condition? Do you think it can be prevented? Atherosclerosis is a specific form of atherosclerosis affecting primarily in the intima of large and medium by-sized muscular arteries, and is characterized fibrofatty plaques or erythromas. The most affected are aorta, coronary, and cerebral atrial system. Major clinical syndrome due to atherosclerosis pertain to the heart, are angina and myocardial infarcts and brain transient cerebral ischemia. Factors that would have been increased the risk of this condition of atherosclerosis are unhealthy blood cholesterol level, high LDL cholesterols, which are bad cholesterols, and low HDL cholesterol, good cholesterols. Sleep apnea, a disorder in which breathing stops or gets very shallow while person is sleeping. Untreated sleep apnea may raises the chance of high blood pressure and even a heart attack or stroke. High blood pressure is considered high if it stays at or above 140 over 90 millimeters. Smoking, this can damage and tighten blood vessels, raise cholesterol level. Smoking does not allow enough oxygen to reach body's tissue. Insulin resistance, insulin helps move blood sugar into cells, and resistance occurs when the body cannot use its own insulin properly. Diabetes, insulin resistance causes body's blood sugar level to be high, which causes high risk of atherosclerosis in patient D. Being overweight, lack of physical activity, age are all the factors. Then we have prevention of atherosclerosis vascular disease. Prevention includes cessation of cigarette smoking, control of hypertension, weight loss, exercise, lowering total and LDL low blood cholesterol level while increasing the HDL by the diet or through statins. Statin use may also modulate the inflammatory state of vascular walls. Risk factor stratification and reduction should be in the childhood. Mr. A is hospitalized due to high blood pressure. He also mentioned that he has been experiencing increased thirst and polyuria. Name and describe the possible condition that Mr. A is suffering from. Mr. A is suffering from type 2 diabetes. Type 2 diabetes is an important in the way that body regulates and uses sugar as a fuel. This long-term chronic condition results in too much sugar circulating in the bloodstream. Eventually, high blood sugar level can lead to disorder of circulatory, nervous, and immune system. In type 2 diabetes, there are primarily two interrelated problems at work. Your pancreas does not produce enough insulin, a hormone that regulates the movement of sugar into the cell, and cells respond poorly to insulin and take in less sugar. Type 2 diabetes used to be known as adult onset diabetes, but both type 1 and type 2 diabetes can begin during the childhood and adulthood. Type 2 is more common in older adults, but increase in number of children with obesity has led to more cases of type 2 diabetes in younger people. There is no cure of type 2 diabetes, but losing weight, eating well, and exercise can help you manage the diseases. If diet and exercise aren't enough to manage your blood sugar, you may also need diabetes medication or insulin therapy. Okay, patient B presented to the hospital with 1 week of constipation. We have already covered this. Explain why mice lacking oxytocin do not eject milk even though they produce milk normally. Milk ejection reflex requires oxytocin receptor mediated depolarization of the myoepithelial cell membrane, which would cause the contraction of myoepithelial cell. The number of oxytocin receptor increases greatly during pregnancy of mice and remain active till lactation lasts. The milk ejection reflexes initiate when impulses are generated from nipple, which causes activation of paraventricular or supraoptic nuclei of hypothalamus. As a result, hypothalamus sends a signal to posterior pituitary glands to produce oxytocin, which causes the contraction of myoepithelial cell of alveoli and duct of mammary glands. Thereafter, milk is ejected into ampulla of lactiferous ducts and further sucked by the newborn. When mice lacks oxytocin, it inhibits the contraction of myoepithelial cell of alveoli and duct of mammary gland by inhibiting the oxytocin receptors mediated depolarization of myoepithelial cell membrane. As a result, it prevents the ejection of milk even though they produce milk normally. This was all for today's video. Thank you for listening. If you like my video, don't forget to subscribe for more.